OET speaking is a challenging subtest. Knowing exactly what to do and exactly how you're scored will be the difference between a high score and a low score. In this video, I'm going to teach you everything you need to know about OET speaking. On test day, the first thing that happens is you need to show your ID and answer some simple personal questions which are not assessed. After that, you'll move into the warm-up questions. Why did you choose to become a nurse or a doctor or a physiotherapist, etc.? What kind of person makes a good nurse, doctor, physio, etc.? Tell me about a typical day at your workplace. These warm-up questions are not assessed. It's just a good opportunity for you to relax, take a deep breath, and get used to the interlocutor's voice. What's an interlocutor? The interlocutor is your conversational partner. Importantly, and keep this in mind, the interlocutor is not the examiner. The interlocutor plays the role of the patient or the carer of the patient. Your speaking is going to be recorded on a device and then sent to OET official after the role play. Now, with the interlocutor, you're going to do 2 role plays. The Roleplay Card. It's really important that you become familiar with the Roleplay Card and do practice with it before test day. Now, if you want to do some speaking practice and get familiar with that Roleplay Card, and more importantly, get some great feedback on your speaking, then sign up to E2's OET Mini Mock Test with feedback. You can click the link in the description below. It's a full mock test that includes a one-on-one speaking session with an E2 expert. Let's take a closer look at the Roleplay Card. This Roleplay Card is for medicine, but they're all the same in terms of the layout. As you can see, right at the top, you can see the setting. It will tell you where the role play is taking place. It might be a clinic or a home care visit or an ICU or ER. Paying attention to the setting will inform you of the level of urgency of the role play. Predictably, a home care visit will be far less urgent and will affect your tone compared to an ER, for example. The next part of the Roleplay Card is the scenario. This is critical. This tells you what's been going on, what's been happening, or the background of the patient. You will use this information to initiate the discussion and in the first part of the roleplay to gather information. Just as an important aside, in the roleplay, you are the medical professional. You initiate the discussion. You manage the discussion, you make sure the discussion stays on track, not the interlocutor. That's not their job. It's all up to you. Next, we have the all-important tasks. These tasks will guide you and the interlocutor through the role play. You'll see between 3 and 6 tasks. The tasks always start with a verb, where you have to do something. Some of the tasks have additional tasks embedded within them. Of course, you get to hold the roleplay card throughout the roleplay, and you always refer to it and refer to the patient. Preparation time. So before the roleplay begins, you get 2 to 3 minutes to prepare by reading the roleplay card. Now, of course, you don't have to memorize anything on the roleplay card because you get to hold the roleplay card during the roleplay. And I say 2 to 3 minutes preparation time because maybe after 2 minutes you've had enough, and so you can let the interlocutor know to begin the role play if you want. In the preparation time, you want to pay careful attention to the setting, scenario, and most importantly, the tasks. Now, in the preparation time, you are allowed to write on the role play card. I don't recommend that you write anything, but I do recommend that you underline the verbs in the tasks. Do you see the verbs in the tasks? It's critical that you underline or at least pay careful attention to these verbs because these verbs dictate the type of language, the kinds of expressions that you need to use during the role play. For example, the critical verbs in this roleplay card are find out, request, explain, highlight, reassure, and suggest. These verbs should guide you through the role play. They're exactly what you need to do in the role play. For example, if the verb says that you need to explain something, you probably need to explain a procedure step by step, or how to take medication. Or perhaps you need to reassure the patient, in which case you need to use reassuring language. Roleplay topics. The roleplay topics are on common medical issues related to your profession. Each profession does a different type of roleplay. Doctors do medical ones, nurses do nursing ones, physio do physio ones, etc. Now, you're never going to encounter a condition or an illness or anything like that that you don't know about. Again, it's going to be very common things: asthma, back pain, headaches, etc. Also, bear in mind that most of the time you'll be speaking directly to a patient, but sometimes you'll be speaking to the carer or parent of the patient. Like in this role play, note that it says you are speaking with the son or daughter of a patient. Their father was admitted yesterday due to unexplained severe swelling of the knee and fever. Just make sure you're clear on that. Now, also remember that the two role plays are going to be different. So in each role play, you're going to encounter a different patient, a different scenario, a different setting, different tasks, a different level of urgency, etc. Preparation time, asking the interlocutor questions. In the 2 or 3 minutes preparation time before the role play begins, you're allowed to ask the interlocutor questions, and you should. For example, you might ask, am I speaking directly to you as the patient, or are you the carer of the patient? In this role play, have I met you before, or are we meeting for the first time? What should I call you in the role play? What's your name? How do I refer to you? You can even ask about pronunciation. How do I pronounce this word here? Please don't be afraid to ask questions to the interlocutor before the role play begins. Remember that you paid for this exam and you are not assessed on anything other than the role play itself. Anything before and anything after is not assessed. So do ask questions if you're unclear on anything at all. Timing. The role play will go for 5 minutes. They're designed in such a way that they will last about that long. Now, what happens if you finish early? Well, maybe you didn't extrapolate or expand enough on each of the tasks. It's okay, you won't be penalized, but just keep it in mind. Or what happens if you've only done 2 tasks and 5 minutes is up? Well, it means that you haven't expressed enough language, because each of those tasks try to elicit different types of language from you. Notice how many tasks there are and how many minutes you have. Here, there are 6 tasks that you should aim to complete in 5 minutes. That means you should spend about 45 seconds to a minute on each task. Some will be quicker than others, but it gives you a rough idea. If you are still speaking at the 5-minute mark, the interlocutor is going to stop you, even mid-sentence. Don't worry at all. It just means that you've reached the 5-minute mark. Scoring. Scoring is what this is all about. If you understand the scoring, then you're going to get a better score. Now, you're scored in 2 main ways in OET speaking. You're scored on your linguistic skills or your language skills, and you're scored on your clinical communication skills or your bedside manner. The linguistic skills include intelligibility, fluency, appropriateness, and grammar and vocabulary, and you're scored from 0 to 6 on each of these skills. Intelligibility refers to the impact of your pronunciation, intonation, and accent on how clearly your listener can hear and understand what you're saying. To get a top score for intelligibility, you need to have clear pronunciation. You also need to have effective prosody, including word and sentence stress, intonation, and rhythm. Your accent should not impede the clarity of your speech. You should be easily understood. That's the critical thing with intelligibility. It's being easily understood. Fluency refers to the impact of the speed and smoothness of your speech on your listener's understanding. To get a top score for fluency, speak at a normal rate, not too fast, not too slow. Don't hesitate to search for words or grammar, and you speak effortlessly. Some hesitation is completely acceptable. Even some umming and ahhing is completely fine. But it's not the type of hesitation where you're trying to think of grammatical structures or you've forgotten vocabulary. That's problematic. Appropriateness refers to the impact of your language, tone, and professionalism on your listener's understanding and comfort. To get a top score for appropriateness, you need to use appropriate formality, tone, and phrasing for the context and the person you're speaking to. You should also have no difficulty explaining complex procedures simply. You need to be very careful not to use complex medical jargon with the person you're talking to. You need to explain things in layman's terms, simply. Grammar and vocabulary refer to how flexible and accurate you are in your use of vocabulary and grammar. To get a top score for grammar and vocab, you need to use wide-ranging and accurate grammar, and use wide-ranging and precise vocabulary, and use natural-sounding phrases. I won't go into too much detail about the linguistic skills here, but if you do click the link in the description below, or go to e2language.com, you'll find scoring videos there that take you through each of these criteria in depth. You can take one-on-one tutorials or join our live classes, and you can even join the grammar and pronunciation classes if need be. So, in addition to your language or linguistic skills, you're also scored on what's called clinical communication skills, and you're scored on these from 0 to 3. Broadly, the clinical comm criteria include relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. There are in fact 20 clinical communication sub-criteria, and these are pretty easy to learn. You can really boost your performance on test day by making sure you understand these before test day and make sure you do them on test day. You might have great linguistic skills, you might even be a native English speaker, but if you're not paying attention to the clinical skills, it could decrease your score. In fact, according to OET Official, to get the equivalent score of a B or 350 in OET Speaking, you need to get mostly scores out of 5 or 6 on the linguistic criteria, and mostly scores of 2 or 3 on the clinical communication criteria. What I'm going to do now is show you 2 important clinical communication skills criteria. We're going to go through them in a bit of detail. Now, the other 18 of these videos are not here on YouTube. You're going to have to click that link in the description below and go across to E2 Test Prep to see those. We're going to start with the first set of the clinical communication criteria: relationship building. A1, initiate the interaction appropriately, greeting, introductions, nature of interview. When you start the role play, you should greet the patient, introduce yourself, or remind the patient of your name, confirm their name, and then let the patient know what's going to happen during the interview. You can say something like, "Hi, I'm Dr. J. It's Mr. Smith, isn't it? I understand you've been having some back pain recently. I'd like to discuss that with you today." Of course, this introduction will change based on the nature of the situation, the level of urgency, and the emotional state of the patient, but that's how you need to begin. A2, demonstrate an attentive and respectful attitude. Although this is a speaking test, being attentive refers to your ability to listen carefully, and it's essential for your success. You need to pay close attention to the patient. You need to respond to the patient appropriately. You need to be respectful of the patient, never reprimanding or being rude or offensive in any way. Always be polite. For example, if you need to do something such as inquire about the patient's mental health or ask about their medication history, always ask permission. Would it be alright if I ask you some questions? Do you mind if I suggest a few options? These phrases, would you mind if or do you mind if, are very flexible. Keep them in mind and always pay attention to the patient. You'll find that paying attention to the patient will ease any of your anxieties as well. Remember, that's just 2 of 20 clinical communication skills that you need to use on test day. The other 18, as I mentioned, are on E2 Test Prep. You can join that by clicking the link in the description below. Okay, I want to take you through a really important tip now. Key tip, treat the test like it's real life. The OET speaking test was developed on best practice principles of healthcare communication. So when you're preparing for this test, think about it like professional development. And also on test day, imagine that you're actually in the clinic with a real life patient. Don't think of this like an English language test. Recap. All up, OET speaking will take you about 20 minutes, including the ID check, the warm-up questions, and then the 2 role plays. The key to this test is understanding the scoring, the linguistic criteria and the clinical communication criteria, and then practicing under exam-like conditions, and of course, getting feedback. Good luck on your test. My name is Jay. See you soon.